This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
I'm just going to combine a few questions that look like they're short ones, and hopefully this will be substantial for you to answer. The risks of using fertility drugs and the long-term side effects, and the risks of multiple IVF cycles.
Yeah, I mean, basically they're the same questions. So we've been using the drugs to stimulate ovaries in an abnormal way now since the mid-80s or early 80s. So we're now talking getting close to 45 years. And we always, those of us who have been doing IVF over that time, have always been concerned that this abnormal stimulation of the ovaries might result in something nasty happening in the ovaries. Now, there are registers around the world, particularly in Scandinavia, where the health records in every aspect of an individual's health are recorded, what drugs they've been on, not just IVF drugs, but any drugs. And also it documents very closely health outcomes, i.e. their age and the age of death, the cause of death, and the cause of other diseases like cancer. The evidence from those to date, these very big population studies, is that the risks don't appear to be there. In fact, fertility treatment probably is associated with a reduced risk of uterine cancer, no change in ovarian cancer risk at this stage, although there have been some studies contradicting that in smaller population groups. And in terms of other cancers, there doesn't appear to be any change. In fact, bowel cancer, I think it's the one where, certainly out of the Scandinavian countries, there appeared to be a reduction in bowel cancer. Can't explain why, and these are just associations, but it may be about what an infertile patient is. For instance, the uterine cancer story, if you are infertile and remain infertile, your risk of uterine cancer is higher than the general population. So overcoming that fertility and having a baby may well be protective for that cancer. That's one of the theories as to why uterine cancer occurs less commonly. So in those terms, the treatments that we give to produce multiple eggs do not appear to have significant changes in studies that have been done to date. So that's cancer. In terms of other things, there's no evidence that changes anything in terms of risk of diabetes, risk of high blood pressure. But we're very confident that when we give these doses of drugs, we're not doing any harm. But it is studied very closely, and I'm sure there are going to be more studies coming out that give us a reassurance.
Prof, we have a question from Mondal, who's live with us. Is it very common that no symptoms post-embryo transfer in 2 weeks, you can get positive results after 2 weeks?
Okay, so after we put the embryo back, which is usually, or in these days is usually 5 days after the embryo was formed, and we're putting it back into a uterus, which is generally equivalent of 5 days after ovulation. And so by 10 days after that, we should be seeing a positive pregnancy test or a period. There are occasional situations where the pregnancy test done 10 days later was negative, and then a few days later it turned out to be positive. I've seen it a couple of times. It's called delayed implantation. It's incredibly rare, And so generally, if you get to that 10 days after embryo transfer, and even if you haven't had a period, if the pregnancy test is negative, it's very unlikely that that's going to be successful.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.